Greetings, everyone, and welcome to yet another conversation on the COVID-19 response in Bulawayo. My name is Thando Nkomo, and I'll be your host as we look at yet another topic around the COVID-19 response. And in particular, we are focusing on the state of health institutions in Bulawayo. And joining us in this conversation today is Dr. Mlilo. Dr. Welcome Mlilo, the acting PMD, Provincial Medical Director for Bulawayo Province. Welcome to the discussion, Dr. Mlilo.
Thank you, Thando. Thank you so much for having me.
Yes, we also have Dr. Absalom Dube, who is the acting Chief Executive Officer for Egusileni Hospital. Welcome, Dr. Dube, to the discussion.
Thank you very much.
Thank you. And we also have Dr. Edwin Sibanda, who is the Director of Health Services with the City of Bulawayo. Welcome, Dr. Sibanda.
Thank you, Thando. Good afternoon, viewers and listeners.
Yes. So just to get the ball rolling, gentlemen, COVID-19 has been with us for a couple of months now. And I remember very early on in the pandemic, or very early on following the first lockdown and following the first few deaths that we received in the country, a major concern was the state of health institutions. And this is one thing that really activated, in particular, the I Am for Bulawayo Fighting COVID-19 Trust Initiative and the I Am for Bulawayo Fighting COVID-19 campaign. And we're worried about the health institutions. And the first question that I want to pose to in particular, Dr. Mlilo and also Dr. Spanda is the one around the health institutions. Are our health institutions equipped? You know, we have been talking about equipping these institutions, but how far have we gone in equipping these institutions? Are they ready for the COVID-19 response? Have they been ready enough to take on COVID-19? Maybe you can start, Dr. Mlilo, then we go on to Dr. Spanda.
Thank you for the opportunity once again, Thando. So maybe a bit of background on that particular question. If you remember, at the beginning of this pandemic, we were, like, as most countries really, caught very much unprepared. So we came together, different institutions around the city, to come up with our provincial COVID response plan. And it was basically based on the following: that we would have to identify facilities around the city that will then be designated as COVID centers. So as Bulawayo, we designated 3 centers for the purposes of managing COVID positive patients within the city. So the 3 identified facilities were Thorn Grove, UBH, and Egusileni. So the plan was to really ensure that these 3 facilities quickly come online and manage the COVID positive clients. So Thorn Grove was and is chiefly managing the mild to moderate cases. UBH and Egusileni were really identified to come on board to cater for the moderate and the severe cases. This is within the public health institutions. But of note, we also have private institutions within the city that really came on board and really offered services with regards to management of COVID-19 patients. And chiefly among those was Mater Dei Hospital, which probably achieved readiness earliest as compared to the other facilities. So really, we have come quite a long way in terms of our facilities being better equipped, better prepared to handle COVID-19 patients. As we speak, Thorngrove, I'm sure Dr. Spanda will touch more broadly on how well Thorngrove has really come online and its current status. So Thorngrove is now really fully online and is managing the COVID-19 patients. And at this particular juncture, Thorngrove is managing the mild to moderate cases. UBH as well has really come online. You would note that UBH has two wings, if I may put it that way, the East Wing and the West Wing. The West Wing is now fully functional. It is a 40-bedded facility, and it is managing the moderate to the most severe cases that we have within the province. The East Wing is still works in progress and major development. I'm sure you would have seen some adverts as well around that. Is that Arundel Hospital, in conjunction with Sakunda, came on board and is now in partnership with United Bulawayo Hospitals with the aim of fully equipping or completing the East Wing, which is not yet fully online. So of late, the recent developments have seen a delivery of 40 high-end beds into the facility. There's been a delivery of ventilators as well, and of late, I'm sure we also the advert that came out, that was flighted a few months ago. This has led to actually interviews being held with the aim of actually equipping the hospital with more staff. Arundel is also will also be heavily involved in the completion of the theaters there, such that we are able not to manage COVID medical cases, but to also be able to manage COVID patients with surgical complications who require surgical intervention. I think as for Egusileni as well, we have seen great progress. I will not really touch on that as well, seeing that we have the acting CEO of Egusileni who should be able to really update us on the status of the facility. So I think in summary, in response to this question, we as Bulawayo, we have really made major strides in getting ready for COVID patients. I think it's important that I also mention briefly what has really been happening at Mpilo, because at Mpilo as well, we have seen developments in terms of infrastructure. Firstly, we saw Net1 and Tel1 coming together to refurbish what at Mpilo, B5. Government as well has really put in a lot of resources in upgrading Mpilo, especially with regards to the high dependency unit, which has been upgraded, where we've also had seen upgrades with regards to medical gases. Sections of the hospital are now fully equipped with medical gases, and as well as the lift, which has been a chronic issue, which has been a challenge at Mpilo. This has seen that being looked at, and my last update was that this is almost at 90% completion. The Vice President, who also happens to be the Minister of Health, was also really keen on us sorting out the issues of the radiotherapy machines, and major investment has gone into that, with quite substantial sums of money being invested in that department. Recently, the hospital, under the leadership of the acting CEO, Dr. Ngwenya, recently had a visit from engineers from Germany who had come to have a look at this, and I'm told they recently had a successful meeting with regards to that. So yeah, I think I've tried to sort of like really summarize the major activities around our health institutions, but I've left out a big chunk of what has really been happening at Thorngrove and at Ekuseni, because my colleagues here, the CEO and the director, are with us on this call, and I'm sure they will give us updates on those institutions.
Yeah. Thank you, Dr. Mlilo. Maybe Dr. Sibanda, you can come through and just shed more insight, especially on the situation at Thorngrove and any other institutions that the city of Bulawayo has been working through in response to the COVID-19 pandemic in Bulawayo.
Okay, thank you, Mr. Nkomo, on the issue. In terms of Thorngrove Hospital, we all know that Thorngrove is an old hospital built way back in 1941, but it did have an isolation ward, which in the majority of cases had been attending to gastrointestinal diseases, the last one being the major outbreak of cholera. And it was almost known as the cholera ward. And what then happened is we decided that it needed major refurbishments, because we know that the management of cholera and the management of respiratory illness is chief amongst them. COVID-19 required different equipment, different type of personnel, and lots of refurbishments were required to bring it up to speed. Chief amongst which was the provision of piped oxygen and probably ventilators. But we all remember that Thorngrove is supposed to manage mild to moderate cases. Therefore, ventilators were not on the menu. However, there is a provision that should ventilators become available and the need to ventilate patients arises, a section was reserved for such. So Thorngrove Hospital, the isolation ward, was then renovated courtesy of funding from government, as well as well-wishers who came in with other pieces of equipment. I'm for Bulawayo fighting COVID was also there in the menu. I mean, in the thick of things, we had other donors coming in with equipment, consumables, etc. But what I can say is that after all has been said and done, the ward, the isolation ward at Thorngrove is now a state of the art. Insofar as the renovations on the walls are concerned, the oxygen is now piped, and we have got at least 28 points at which patients can be linked to oxygen, piped oxygen. We have, in addition, tomorrow at 11 o'clock, we'll be receiving beds, state-of-the-art beds, donated for Open Society Initiative of Southern Africa, commonly known as OSISA, which will actually replace some of the beds that we had in the ward. Yes, they have done their time. They were donated by well-wishers. We appreciate their donation, but we have received beds that are more than ideal. We all know that organizations such as Ezra Chisasvanda Initiative had struggled to get the correct beds when they were donating to Thorngrove, because most of the manufacturers were shut down and transporting beds from across borders became a challenge. But the Open Society Initiative of Southern Africa, OSISA, has managed to get the beds arrive in Bulawayo. even then, they had wanted to donate hydraulic beds, but during December and the lockdowns that followed, it became difficult to get the exact specifications. So the beds, yes, they can be moved, but they're no longer as hydraulic as initially envisaged. So people can start from tomorrow at 11 to witness a changed ward at Thorncove, the isolation ward.
Yeah.
It now also has a labor ward. We are yet to take delivery of the equipment for the labor ward, but the labor ward itself, in terms of structural renovations, is through. We also have now the donning and doffing areas for the members of staff to make sure that as they come in and go out, they do not collect or spread infections and risk their own lives in the process of saving other people's lives. These have been the renovations at Thorncove. Our clinics have all 19 of them have all had trainings in terms of screening and testing with rapid antigen testing equipment for COVID. We also have been the people that have been looking after Elangen as our isolation center, Elangen Training Center as our isolation center. And we think it has been doing a pretty good job. It's probably the only one in the country that is not a hospital. Most isolation facilities in the country have been hospitals, but Elangen is not a hospital, and we worked well with the management at Elangen, thanks to their cooperation and the intervention and assistance from the office of the PMD. Our laboratory at Thorncove has got one of the largest, the Gene Expert machines, a 16 module. This was then upgraded by way of software to enable it to test for COVID-19, and a lot of tests have been done there. And this has, in essence, reduced the turnaround time for COVID testing and enabled our staff there to get results as soon as they would want them, especially in cases where decisions have to be made early by way of isolation or admission.
Yeah.
We also have had staff seconded by the Ministry of Health through the central hospitals in Pilo and United Bulawayo hospitals. These staff have been doctors, a total of 6 of them. They may be a little more now, as well as not less than 20 nurses have been forwarded or seconded to Thorncove, including 2 sisters in charge, to enable the ward to function fully without straining and stretching the resources from the human resources, in particular from the city of Bulawayo. We all know that the city has been functioning with less human resources than is ideal.
Yeah.
So that part, we think, has been very, very helpful, and a lot of people have been admitted and gone through this ward after it was opened. Of course, there was no official fanfare and all the hype that goes with an achievement of this magnitude, but we just got it working, and we now know that it can work, and we've admitted and discharged people from Thorncove so far. Since the outbreak began, not less than 50 people have gone through the doors and the gates of Thorncove.
Yeah,
I think so far that is what I can say.
Yeah, thank you so much, Dr. Spanda and Dr. Mlilo, for such a comprehensive update. And I think anyone who is listening to this and who is listening to you share this, the progress that has been made in as far as our institution are concerned, is really getting a good picture of what is on the ground, and and the amount of work that has actually taken place in ensuring that institutions in Bulawayo are able to handle the task that COVID-19 has presented to us. Now, one of the things that was really a focus for the people of Bulawayo, and indeed everyone else in the country and people in the diaspora, was Egusileni Hospital. And I'd like Dr. Dube to come on board now. Dr. Dube, you are the acting CEO of Egusileni, and there's been so much expectation around Egusileni Hospital, its opening, and the hospital actually playing a role in the COVID-19 response. What has been done to date, and where do we see, this hospital, given the context of the COVID-19 response in Bulawayo? Just take us through what's on the ground, Doc.
Thank you very much, Nkomo. As everyone knows, Egusileni was identified as one of the hospitals that should come along in the management of COVID-19, as the PMT has highlighted it. What then in April, sometime last year, is that it then included the stakeholders, which are among them the government through the Ministry of Health being the main pillar, the National Institute of Science and Technology, NIST, and the National Social Security Authority, which is NASA, and the Bulawayo City Council. All these came together, and I'm for Bulawayo as the private stakeholders, not to mention last, but equally as other stakeholders. So these partners then came on board, and we then sat down to come up with a strategy of how then we can bring this 200-bed capacity hospital on board in the management of COVID. And fortunately, the hospital is already existing oxygen piping, and it has been lying idle for more than 17 years. Hence, we then sat down to see whether the infrastructure-wise and its renovation or completion of work, was it at par for it to safely manage the COVID-19 cases. So on coming down and listing the list of infrastructure work, the government immediately pushed an amount which was reasonable, and this amount was mainly consumed through doing the infrastructure work, which included the installation of sinks and the elbow-operated taps, changing of door handles, and the attention as well on other issues like removing the carpet. It was partially carpeted, so removed part of the carpet, and the issue of ambulance washing bay, the man was also used in servicing as well the oxygen piping that was there. So for now, the hospital has got a functional oxygen piping system with a capacity of more than 160 bed capacity. And fortunately, I am for Bulawayo mobilized an oxygen tank, which was installed sometime in August last year. And it has been tested and is ready to run the hospital. And we also did some painting, ceiling works, the sluice room completion of works, the staff workways. All these were mainly infrastructural. However, because the hospital was meant more than 20 years ago, or the plan was adopted long back in view of managing non-infectious cases. So when COVID-19 came along, the WHO protocol came up with some recommendations, and among them, the ventilation aspect was key so that we avoid the cross-contamination or infection of staff. So mechanical ventilation came on board, and there was a need because the wards and all these other areas, they're clustered together. For those who came to explain, will tell you that there's no free air that can blow from one end of the window to the one edge of the hospital because of the design of the hospital. So the mechanical ventilation was one of the top priority key issues which needed to be taken on board. However, fortunately enough, we had some further allocation of funds, which happened sometime in August. So we had almost 5 to 4 months where the funds allocation for the hospital was not up to its expectations in terms of the required infrastructural work to make it able to take up the first COVID cases. So, but suffice to say, we've managed to mobilize funds, with the NASA being the main key player in the mobilization of these funds. And we have since started the works that we lined up for it to be key. Among the works, the issue of PABX and installation of telephones, key in the communication aspect, the issue of network connection in terms of internet, because this is more like it is. We found that the hospital was more like a shell that was ready to have certain infrastructural works being done so that it can be able to manage the cases. So we also managed to put along the issue of autoclave. So the autoclave machine is not yet on site, but all the tendering process and the sourcing of autoclave through one of the companies which won the tender, and we are expecting this in the next 2 weeks. And this company said worldwide there was the issue of autoclave scarcity, and demand has been so high that you have to order it and it has to be manufactured and delivered according to a specification. So as I speak, the contractor is on his way from South Africa to bring this autoclave, and we are expecting this to be installed in the next few weeks. The issue of workstations and laundry room, the major part of donation was done through IM for Bulawayo, which mobilized, and the main company which was involved is the United Refineries. So the laundry equipment in terms of the washing machine, the industrial dryer, and the industrial iron, they're already on the site, and it is just awaiting connection, subject to completion of some extraction aspect on the laundry room, due to the fact that the hospital, in terms of its building or purpose building, it was not complete. So we had to figure out how to come up with an extractor in the laundry section. And this is being done by one of the companies which is doing the main tasks that we are concerned with. Initially, we looked at opening the full capacity of 200, but we quickly narrowed it down to 50 beds. And for now, we are even further going down to as little as 15 beds, with 5 ICU and the ICU beds and the 15 general beds, general ward beds capacity. Not also to downgrade the capacity of the hospital. Just to summarize, it is a 200 bed capacity with the 18 ICU bed capacity, and 12 kids and 6 maternity bed capacity, and 6 theaters in terms of its design. And we've got a neonatal intensive care unit with a capacity of 5 beds. And the general wards, they've got 4 wings of almost 32 bed capacity, bringing our total to around 200. So it is quite a big hospital, but if we are to start and open it, we have to start small and also increase its capacity on a sliding scale. So all the stakeholders, they are in agreement that it has been a baby that has been pampered for a long time, and it's high time that it comes on board and help to relieve the admissions for Thornycroft and UBH, as it has been highlighted. So most of these infrastructure work that I have mentioned, including the staff walkway and the donning and doffing, these we are left, most of these infrastructural works, they are beyond 80%, and we have been given a timeline of about 2 weeks. Some of them we've already they had already been given their completion certificate because they are done with the infrastructure work. And this week we expect some PA units, the fire detection unit, to also go off-site as they've completed their works, including the construction of the staff walkway, covered staff walkway, the waste storage areas, and as well as the fire detection system. So all these issues have been coming on board infrastructural wise, and we have sat down as management and other key stakeholders, and we have found that the funding of infrastructural works is almost complete, with a time frame of about 2 weeks. For those who are interested, the contractor who is doing the negative mechanical pressure ventilation, they are now almost 60%. They've indicated, according to the last meeting that we had last week, that they should be through with the works in the next 2 weeks, once the consignment which they are bringing or importing from South Africa is on site. So as I speak, I've been informed that the truck is on its way from the border. It has been cleared, and we should be offloading this equipment tomorrow. So they said after 2 weeks from receiving these equipment for the negative pressure installations, they should be ready to leave the site and have it certified. And these include the ducts for the ICU and the theaters, the HDU, and the corridor that lies between the two sections of the hospital, which doesn't allow free laminar airflow. So suffice to say, infrastructure-wise, there's been some progress. There are some issues which you've got a positive development. These are the medical equipment, which has been mainly having the Iron for Bulawayo fighting COVID, having the sole player mainly mobilizing the beds. They've managed to mobilize about 20 ICU beds, 48 general wards beds, some bedside assortments, which are in the number of 30s. This includes the bedside cupboards, the footstools, the drip stands, and the patient benches. And this we have already set up in the unity, and we have used 2 wings of 32 bed capacity. Although not to full capacity, we have, for those who want to see, they can come to explain, and we can have a tour, and you'll see the progress that has been done so far. However, there are some bedside few assortment like the BP, the monitors, the blood pressure monitor, the weight scales, the other mainly like the insulin syringes, which are needed for the management and key in the aspect of managing COVID. So these are in the process of being mobilized. Once they come on board, and in 2 weeks' time, the infrastructure is ready. If we have got 2 beds, then we'll work with those 2 beds. If it is 5 beds, we'll start off with those 5 beds. So for myself, I'm just giving before the end of this month, we should be seeing this long-waited institution being commissioned and starting to take COVID-19 cases. As for staffing, we also have a staff of the complement of about 55, which were employed through the treasury allocations. And we have got about 6 HMO doctors and the nurses, nurse aides, the general hands or cleaners, and some of the office bearers. So in terms of staffing, with our target of 15 beds initial opening capacity, we should be able to handle with of a few cadres, because mind you, in COVID, in terms of the duration, we don't want people to spend more than 12 hours in a COVID facility because there will be laxity and there are high chances of infection. So these medical equipments, which I'm for Bulawayo costing in the region of 125,000, if I remember very well, they are looking for donors. Whatever we get, the donation, then we'll start to put up. I'm very happy that in the Thorn Grove, they are still receiving some equipment to put up in the facilities. For as Epsilon, we are also open to that. Once we are so medical bedside assortment equivalent to increase the capacity by 5, then on that day, immediately, we are at 5 bed capacity. We add on and we cascade until we get to the 200 bed capacity. It is a long milestone, but what I can say to the community, I know they've lost hope a bit because of some terms in terms of the opening dates changing. All these are due mainly to the funding stream to the hospital. We also have the issue of operational budget, which is almost has been sorted in terms of to allow the hospital to self-sustain. Remember, this hospital will be admitting COVID patients, and these patients will be treated and discharged free of charge. It's not a private institution, but it's one of the public institutions which the government saw it fit to come on board and increase the admission bed capacity in Bulawayo. We also have the issue of office furniture, which also need to be sourced and or looked for donors to buy those, and ICT equipment, the issue of transport. And if these issues are improved, or they are catered for, the hospital should be working in the next few weeks. I know it is normal that as you are reaching the finishing line, you feel a bit tired because some have donated in terms of community and they've been asking, we have donated, but why are we not making use of the bed that I donated? Use the bed in isolation. We also need to monitor it. So all these issues, they make the facility ready. And I can breaching block. This is also near in a nutshell. This is what I can say. Thank you very much.
Thank you so much, Dr. Due, for such an enlightening response to the question. Clearly, from what you've just said to us, Egusileni is almost ready. You've really highlighted there that we are 80% towards opening, and you've also preempted my next question to you, which was to say, in the event of a third wave, COVID-19 third wave, will Egusileni be ready? And from what you have said, I can bet my bottom dollar that indeed Egusileni will be open and taking patients. Thank you so much for that response, Dr. Dube. Now, Dr. Spanda, I want to ask a question directed to you. The city of Bulawayo has about 19 clinics that you mentioned earlier on, and when you think about the frontline health workers, do we have enough of those? How has City of Bulawayo been able to mobilize enough frontline health workers to handle the COVID-19 response in the city?
Thank you, Mr. Nkomo, for the question. In terms of frontline workers, the City of Bulawayo has been struggling with resignations, mainly instigated by the probably exit of Britain from the EU. I think that has had an effect. Since January, we have been receiving not less than 4 resignations a month from the city. And like I said earlier, we did receive nurses, doctors, general hands, instrument technicians, as well as cleaners from the government through Mpilo and United Bulawayo hospitals. These were seconded specifically for COVID activities, and they have been manning our isolation center at Elangen, as well as the isolation ward at Thorncroft. But for the clinics, the 19 of them dotted around the city, we have been running between 45% and 55% staffing levels. And you'll recall that these staffing levels were calculated when we did not have outbreaks. And outbreaks were very rare and probably managed at Thorncroft, all of them. So in terms of admission facilities, we're okay, but out there in the outpatients units, which is the health facilities, the clinics at in the suburbs, we are having a challenge. We do not have enough staff.
Maybe Dr. Mlilo, you can also come in there. From your office, I'm sure you have a bird's eye view of the state of frontline health workers. What's your take on the challenge around getting enough frontline health workers to meet the COVID-19 challenge? Remember to unmute yourself, Doc.
Thank you. Yeah, I think with regards to human resources for health, I think this is probably a trend right across the country, not just in Bulawayo as a province, where we have seen since the beginning of the year or earlier last year, we have seen quite an alarming number of resignations, if I may say. But I I think well before that, the ministry had already committed to actually relooking at the establishment of the health facilities around the country with the intention of actually availing more posts so that we are able to handle this pandemic more efficiently. So I think recently you would have noticed that the Health Services Board had unfrozen quite a number of posts and actually created additional posts within the ministry. This has seen additional nurses, environmental health technicians, and so forth, other health cadres being employed within the ministries. So Bulawayo as well, like the rest of the provinces in the country, received substantial numbers of nurses and the environmental health technicians, which are really key in the COVID-19 response. But as my colleague Dr. Spanda has highlighted, we still have seen we are still having this challenge of flight of skills within the health institutions. But of late, I think it's important to also look at the number of admissions that we have seen, the number of cases that we are picking up as a province or as a country. I'm sure we are all keeping tabs with the national one pager, with the number of cases also of COVID cases dropping nationally within Bulawayo as well, and the number of admissions also dropping within Bulawayo. So definitely human resources for health has been a challenge, but thankfully this current wave of COVID-19 seems to be dissipating. The challenge now is really to prepare for the third wave, and this is an area of concern, and I'm sure as the Ministry of Health, we will be really tackling this issue quite rigorous.
Thank you so much. Thank you so much, Dr. Mbilo, for that response. Allow me at this juncture to invite our viewers from everywhere, those of us who are following this discussion. It's not a live discussion, it's a pre-recorded discussion because we had some technical challenges. If you are watching this discussion, feel free to share your comments and share your questions, share your views on Facebook so that we can, possibly forward these comments and respond to these comments as soon as we can. And we also want to really appreciate the Center for Innovation and Technology who are making, who are working with IM for Bulawayo in ensuring that these conversations are brought to you live and at times pre-recorded via the various social media platforms. Now, let's go on to our next question, gentlemen. And I remember a couple of months ago, we had the challenge of PPE, personal protective equipment. And now that we have just touched on the issue of frontline health workers, and I know that some of them at some stage were worried about having enough equipment to protect them as they are doing their rounds and as far as COVID-19 is concerned. How far has this been dealt with? Maybe I'll throw this question back to you, Dr. Mbilo, just briefly, and then we also want to get some insight from Dr. Spanda there. How has the issue of PPE in the hospitals or in the clinics been handled? Are we having enough, or are we having gaps that still need to be filled? I know even I'm asking this question at a time when COVID cases seem to have gone down, but at the same time, we do not want to appear to be, losing focus because anything can happen. What's the state of PPE? Maybe you can start, Dr. Mbilo, briefly, and then we can have Dr. Span.
Thank you, Nkomo, for that question. So with regards to PPE, I think firstly, it's important to highlight that this seems to be a moving target. At one particular point, the PPE is quite there. At another point, it might not really be enough. But I think government and the ministry has done quite commendably. The support as well from private from the private sector has been quite remarkable. This has really seen the amount of PPE within our health facilities quite increase. So I think we have initially we had quite a lot of challenges. This also probably included the systems within the health facilities to monitor this PPE and to ensure that it actually reaches the frontline healthcare workers within the department. So I think our NatFarm has really improved quite a lot on this, and we have seen of late fewer worries with regards to PPE. There's been really fewer issues around availability of PPEs within our health facilities. So I think we've grown from strength to strength with regards to this, and this in no part as well due to our partnerships with be it the NGOs within the local within the health sector, be with due to assistance from the private players as well.
Yeah. All right. Thank you so much, Dr. Spanda. Can come through.
Thank you, Mr. Nkomo. I think on the issue of personal protective equipment, or PPE in short, we must actually recall that when the outbreak was first detected, most of us did not know or understand how the germ is spread, how we can protect or could protect ourselves. So we all wanted to go for the highest level of protection. And all of us imagined that we were all supposed to be in space suits, goggles, face masks, and maybe a face shield to top it all, double gloves and overshoes and all. But as we understand the outbreak and the evolution of the virus, its transmission, transmissibility and all, we've all come to realize that we need less and less of the PPE, except in certain areas. This is where maybe space suits may be required, goggles may be required, face shields required. The protocols have been changing in terms of which cater needs which kind of protective, personal protective equipment, PPE. That way, we have had a situation where people have realized that we don't need as many spacesuits as we have been using, because we did have at some point people at the gate who were checking temperatures of people coming in to see who was feverish and who wasn't, requesting, excessive PPE. Maybe it was, which was bordering on misuse, overuse, and if not abuse or outright. So that way, most of the PPE is now relatively adequate. There has been also an evolution where some of the PPE is now produced either locally, or we are now producing reusable PPE in terms of things like nurses' gowns, etc. All these things have made PPE relatively more available and adequate for the use. And as the cases go down, we actually need less and less of the PPE.
Yeah, right. Thank you so much, gentlemen, for that. Now, looking forward, we're running out of time, so we want to wrap up this conversation. Now, looking ahead, we're currently in vaccine rollout season, and we're also possibly looking at a third wave sometime in winter. It might happen, it might not happen. what lessons have we learned? You know, maybe all of us in our various stations, Dr. Spanda at the city of Bulawayo, Dr. Mlilo as PMD, Dr. Dube at Egusileni. What lessons have we learned in as far as the COVID-19 response at health institution level is concerned? And what role do you see your institutions, the institutions that you're currently leading, what role do you see them playing going forward as we respond to COVID-19? Let's start with Dr. Dube.
Thank you very much, Mr. Nkomo. We are happy that the country has started the vaccination program, the Sinopharm vaccine that started sometime last month. We are grateful and we are hopeful that the vaccine will be very effective on the strain that is currently available in the country. As I know previously, there was still genome typing or investigation to see what strain is more prevalent in the country. So what we just keeping our fingers crossed, because we don't have enough data, is that the Sinopharm vaccine will be more effective for the variant that is available in Zimbabwe. Although it has been proven in other countries to be effective, more than 80%, if I can say, if we're fortunate enough, the variant we have is similar to what those countries have, then we might see the third wave being less in terms of the severity of the disease, the number of hospitalization, as well as eventually the mortality or people who are going to succumb to the COVID-19. That is merely what the vaccine do, because it just generates an immune system to be more stronger or to have a memory in attacking the COVID-19 virus once you contract it. So in essence, some of the studies have shown that if you have got strong immunity against the virus, then you might be able to deal with it before you transmit to the next person. So it's quite key to have the reasonable number of people, which studies have shown that more than 60% of the population have to be vaccinated for us to benefit what we call herd immunity. So we just keep hopeful if the next consignment comes that the vaccine will soon move to phase 2, then phase 3, where we have got schools opening. So we just hoped that the teachers, the pupils that are eligible, those who are over 16 as per current recommendation, or 18, if I may say, initially. So if these are vaccinated for against COVID-19, they've gotten their second doses or 2 doses, they might have strong immunity, and that will actually flatten the curve for the third wave. But suffice to say, the third wave threat is looming. You've mentioned about winter. We also need to mention about Easter, how we are going to handle the Easter celebrations, movement of people, opening of borders, and easing of lockdown measures. All this might actually propagate a faster spread of the virus, and we hope that we'll keep a very close trend as to the cases of COVID. I know people might be put offshore a bit because of the current statistics, but these are people that come forward and get tested. So the habit of testing as well, the habit of health-seeking habit as well, all these will come in as factors for us to be able to pick the correct prevalence of the disease in the community that we are catering for. So suffice to say as to what role the institutions will play. The institutions will play almost a similar role, although if vaccine has helped us in flattening the curve, we have less numbers of people needing admission. That will ensure that the current resources that we have in terms of staffing, PPE that we're talking about, we can then adequately distribute that or make use of it, and you've got less stress of or strain on the health institution. Hence, better optimal management with the preservative or the saving of the resources at our disposal. So that's what I can say. We need to be very careful in schools opening, management of Easter, opening of borders, and also our checkpoints that we have created in terms of, you heard Dr. Spanda talking about temperature checks, this and that. The lockdown regulations use of sanitizer, those that are opening, do they meet the WHO regulation in terms of what is expected of an institution for it to continue to be operational? This is what I can say in a nutshell. I know my colleagues will add more to that. Thank you very much, Mr. Gomo.
Thank you so much, Dr. Dube. Dr. Mlilo, you can, or Dr. Spanda. Yeah, maybe let's start with Dr. Mlilo.
Thank you. I think on the COVID vaccination, I'll probably want to really congratulate the government for actually getting such substantial amounts of vaccine doses into the country. I think if you're really aware, there is quite a lot of global vaccine nationalization, if I might call it, or politics around the vaccine, with European giants, the Americas, actually hoarding this vaccine, you know, threatening actually putting the rest of the continent probably at greater risk. So I think for Zimbabwe to actually get such substantial doses of the vaccine already coming in, for us to already have launched a nationwide vaccination program ahead of other big, nations. This is quite a significant feat, and I think major congratulations to the government of Zimbabwe on achieving this. My colleagues and I are quite fortunate to be amongst the health workers who have benefited from this vaccine. We are most grateful, and we feel privileged to have been among the first people to actually get this vaccine. And we really encourage the community to take up this vaccine. Vaccination is really good science, and you can really read on it. The history is quite there, and this vaccine you can also read on it, and I think the myths and misconceptions on this particular vaccine are quite unfortunate. I think we want to encourage the community to really get on board, and we really get to that 60%. Remember, that is the target we want to achieve herd immunity. 60% of the nation must be vaccinated for us to have the most benefit from this vaccination program. So really, we encourage the public to really come on board and be part of this. On the lessons learned, I think there have been quite a number of lessons that we have learned from this pandemic. I think my colleague Dr. Spanda initially touched on how it was spread. We initially didn't really understand that, and it contributed to overuse of resources and so forth. So really now we are quite able to manage our resources better. We are able to coordinate better, to know where our resources should be channeled. I think our surveillance mechanisms now are much more robust. We know which areas, which groups of people to target for testing, for example, so that we actually get a higher yield of these positive cases, and ultimately be able to control the spread of the vaccine. We now know that there are certain super spreader events. Initially, if you remember, funerals were not really well managed, and these really caused quite a bit of havoc. So we now know quite a lot about about the spread and how to actually stop the spread of this vaccine. We now know that really masks are really helpful at mitigating the transmission of the virus. There's quite a lot. I think we can go through probably each pillar, each response pillar. It has a lot of lessons. We now know which medicines, for example, in clinical case management of COVID cases, We know which medicines that work and which ones don't work. We know that the president of America, for example, might have received stuff that really doesn't work. So there's quite a lot of lessons that we carry with us into a potential third wave. Critically, I think as well, we have learned how to engage the public, messaging, what sort of messagings we need to take out to the public, how we can package those messages, and how we can really interact with the public with regards to them. So I think the lessons we at this point we could probably write a book around that. But we are really confident as we go into a potential third wave that our health institutions, all of them, will be fully online. We should be better prepared for a potential third wave, and all these lessons will be taking them through to tackle that wave.
Thank you so much, Dr. Mlilo. Dr. Spanda, your parting shot.
Nkomo, for the question about the lessons learned and the rollout of vaccines. What we have learned in terms of the vaccine, this is still work in progress, and we are writing on the existing structures of immunization that we have always had. For the city, we all know that any vaccine that runs in the city is actually administered through the structures that hinge on the vaccine storages in the city health department. And this structure has worked very, very well in actually administering the current vaccine, the Sinopharm vaccine. And we, both in terms of community engagement, that is recruitment of potential people that will be vaccinated, as well as getting the vaccine to the people in the correct state and administered correctly, and doing all the recording and reporting that goes with it. So far, I've got statistics up to the 3rd, and we had reached 57.3%, and only 2 vaccine doses had been wasted, which is a very, very negligible percentage. If you are looking at that, we had administered doses of 3,784 successfully, and only 2 doses had challenges, meaning these were human errors. That tells us that the system is now almost perfect, and that's the system that has been running the vaccination. The communication that goes with vaccination is something that we have been doing over the years. We've been administering other programs, including the mass drug administration against schistosomiasis and filariasis, etc. I think we learned something there. In terms of case management, we have one of the things that we learned is that how do we manage someone when they are diagnosed positive? We have managed to tell the story, and we wish all the other media houses and outlets could tell it more and wider and more often. That is, when we take you away from your comfortable home to Elangeni Isolation Center, we are not accusing you of having COVID or condemning you to anything, but we are trying to make sure that the community out there is safe, and you help us not spread COVID-19. So if more and more of us could take up that offer of isolation away from home and not breach the isolation protocols, the virus will obviously not spread. And the other thing that we've also learned is that lockdowns, at least in terms of virus spread, they assist. They may hurt the economy, hurt the egos, kill the other things, education, etc. But in terms of virus spread, they work. And lastly, if we keep testing people and do the proper reporting and reporting under surveillance, we will track and follow the evolution of this disease, as well as predict that we are likely to have a third wave or that we are not likely to have one. So we are doing that testing. And like I said, if we could get all the resources in place and we expand, we will be ready for the third wave, if and when it comes. And like I said, Thorncliffe is already receiving more equipment as early as tomorrow, and it works. And if all of us come together, we will actually overcome this malady. Thank you very much.
Thank you so much, Dr. Spanda, and thank you as well, Dr. Mlilo, Dr. Dube, for joining us on this conversation around the COVID-19 response, specifically focusing on the state of health institutions in Bulawayo.
Thank you so much for having us, Tando. I think it's been a pleasure, a pleasant conversation.
Thank you very much, Mr. Nkomo. Thank you, everybody.
Yeah,
Thank you very much, Mr. Nkomo, for organizing this. Our apologies for starting a bit late, but I really appreciate your support, as well as coming up with such a very prudent program to educate the community. Thank you very much, and thank you very much, everyone.
Indeed, thank you. And thank you very much to our viewers who have tuned into this program. And thank you very much to everyone who keeps following us as we tell the story of the COVID-19 response in Bulawayo. And thank you as well to our partners, the Center for Innovation and Technology, who have continued to provide us with technical support to ensure that these and other conversations come to you. And until next time, it's a pleasure. See you then.